Welcome to Black Health, a weekly talk show discussing medical issues affecting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Greetings, everybody. Thank you so much for joining us and welcome to Black Health. Black Health brought to you by the Health Foundation of South Florida. Black Health is a platform to discuss health issues affecting the Black community, and I am your host, Dr. Michelle Kirwan Blythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. And today we are talking about minority mental health with Ruban Roberts. Welcome to the show. Welcome to Black Health, Mr. Roberts.
Thank you for having me.
Absolutely. I'm going to take a quick moment to introduce you to our audience. Mr. Ruban Roberts is the founder of Amplify Community Resources and has dedicated his career to addressing and mitigating mental health disparities that disproportionately affect minority communities. His organization not only provides crucial services, but also spearheads initiatives that promote mental wellness and resilience through community engagement and education. Mr. Roberts, that's a mouthful and sounds like you are a very busy man.
Yes, I am.
Can you share what inspired you to found Amplify Community Resources and focus on minority mental health?
Sure. Well, it's not a departure from the work that I've been doing most of my life. It's my life's journey. I started off working with youth from urban core communities, working with a lady by the name of Georgia Jones Ayers in a program called the Alternative Program or the Last Chance Program. And from there, it stemmed from me going on to receive my master's degree in social work and becoming a therapist, and then at the University of Miami, and then becoming a master clinician in the model of family therapy that we developed at the University of Miami called Brief Strategic Family Therapy. I really started off initially in college wanting to be a computer programmer, but I had to do some summer work, to make ends meet. And I got connected with Miss Ayers, and that just changed the whole momentum. I felt so rewarded by being able to have an impact on those youth and families that I've worked with during that time.
What are some of the specific mental wellness programs and services that Amplify Community Resources offers?
So we have basically 3 signature programs. One of our programs, and you see me wearing the shirt here, is the Teen Talks program. Our Teen Talk program is a program that we designed probably about 20 years ago to work with youth, inner city youth, and law enforcement to try to bridge the gap between them, deal with some of the difficulties that they were having. We want to make sure that there is a equitable understanding of each person's position. And we with that incorporated mental health work that we were doing, social emotional learning and that sort of thing. And so we have, with the Teen Talks programs, we have 8 modules that we do, such as nutrition, yoga, mindfulness training. We do conflict resolution. We do, again, the social emotional learning, and so on, and as well as a cultural field trip that we do with those youth and police officers at the end of our program session. So that's one. The other program that we have is a mental health and wellness program. And in that mental health and wellness program, we custom design workshops and seminars that we do for municipalities. Currently, we have a contract with, we work with the city of Miami, Miami-Dade County, Miami Gardens. We work with all of these entities where we provide mental health services, not direct services, but in terms of workshops, seminars, and so on. We've had, we were doing a viewing of the film Hush, which stands for Help Us Say Help, and then having a discussion after that filming. And it really talks about the trauma that we're experiencing and how that trauma, the historical trauma, relates to some of the symptoms and signs that we face today in terms of mental health and wellness. And then finally, we have our HBCU Health and Wellness Tour. We kicked that off about a year ago. We've completed 2 in the state of Florida. We've done Florida Memorial University, and we've also done Edward Waters College immediately after the shooting in Jacksonville. So that was something that was very profound, where students were still struggling with, the idea of someone coming on their campus that was going to be were planning to shoot. Luckily for them, the security escorted them off the campus, but the perpetrator ended up shooting folks in the community nearby. So that's something that those are some of the things that we do at Amplify Community Resources.
Mhm. We're having a little bit of technical difficulty. We are going to go ahead and take a break. You are watching Black Health. We're going to take a quick commercial break. Black Health is brought to you by the Health Foundation of South Florida. We are talking with Mr. Ruban Roberts of Amplify Community Resources, and we will be right back to talk more about minority mental health.
The sound of your heart can tell us so much. At Baptist Health Heart and Vascular Care, we listen closely to diagnose and treat simple to complex cardiac and vascular conditions. Our team of multidisciplinary physicians utilizes the latest treatments and minimally invasive techniques so that you can get back to what you heart most. Welcome to Innovative Heart and Vascular Care.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
The August 20th primary election. It's your voice and your vote, so make it count. Request your vote by mail ballot before August 8th. Easily track and confirm your vote online. Take action at miamidade.gov/elections or call 311.
Hey Miami-Dade, the August 20th primary election is approaching. Register to vote or change your political party online or by mail no later than July 22nd. Visit miamidade.gov/elections or call 311.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
Miami-Dade, we have an important choice this year, who we elect as our sheriff.
It's been 60 years since we elected this position, and the choice is clear for me. I'm with Chief James Reyes.
I'm with Chief Reyes too, because he understands our community and is the most experienced to keep our neighborhood safe.
Chief Reyes has a plan to take on public corruption with a dedicated unit to deliver accountability for our community.
This August, join us in voting for Chief James Reyes.
Thank you for staying with us. You are watching Black Health, brought to you by the Health Foundation of South Florida. And we are back with Mr. Ruban Roberts talking about minority mental health. Mr. Roberts, how do you identify the specific mental health needs of minority communities, and how do you reach the community?
Well, we reach the community, one, by having that cultural sensitivity, understanding the perspective of folks who are from our community. And the way that we reach them is we reach them by being able to be accessible to them at venues and places where they will attend. we try to bring our workshops, our seminars in a place that's going to be convenient for the folks that we're trying to reach. And that's something that we do, and we take painstaking efforts to do that. So we partner with different organizations, we partner with different events and activities to make sure that we have access to the population that needs to hear this information.
Is there a link between lower socioeconomic status and mental health? Are there specific mental health challenges that individuals in a lower socioeconomic bracket might face?
Yes, I think that when you're dealing with resources, it really makes a difference. So if I'm a person that has medical insurance, if I can afford to purchase my medication that I may be prescribed by my therapist or psychiatrist, then that's going to make me a little bit. It's going to help me out with whatever it is that I'm dealing with. I think that it's a resource issue in most cases. Knowing how to look for the appropriate practitioner to service whatever your needs are, knowing how to access particular services that you may need, having that sense of awareness. And I think that when you have more resources available to you, then that's something that is not as difficult for those who don't have the resources or don't have the information. So the gap there becomes in access versus in not having access. And I think that's the primary gap between those folks who are in a lower socioeconomic status. It's just about having information, access, and awareness. And those who are a little bit more resourceful, have a lot more resources, I think that they have an upper hand as far as those things are concerned. That we need to make sure that we are seen, heard, and respected. And so, yes, when you talk about those differences where it comes into race, there's so many different elements that we have to face as Black people that other folks don't have. We just saw it recently on if you watch any of the political pundits, or if you saw the interview with the former president at NABJ, questioning the vice president's racial background, whether she's Black. And these are things that people who are not Black don't have to deal with on a regular basis. When you are born this way, when you're born Black, and it's a good thing to be born Black. It's a positive thing to be born Black.
Amen to that.
Something that we should all be proud of. But when you're constantly faced with that, sometimes it can take a toll on you from a mental perspective.
That's so true. You spoke a little bit about cultural competence earlier. How can mental health professionals improve their cultural competence when working with Black patients? Because even
you need to know.
Even within the Black community, you have Black Caribbean, Black Haitian, Black African. So how do we overall, and even for a non-Black practitioner working with a Black patient, how overall do we improve cultural competence?
So as a practitioner, one of the first things that we learn is that we need to join with our patients, right? So you have to build and establish a rapport. And part of that relationship is just being able to understand, a little bit about the culture, the background. And you don't have to start with your patients. That's not where you want to start. You have to start with your own personal life. Who do you interact with? Who do you speak with? Who are you connecting with to know? Black folks are not a monolith, right? We have Black Republicans, we have Black Democrats, we have Black people from all over the place. I was born in the Bahamas, raised between the Bahamas and the United States. So there's some different cultural aspects to my life than it is to somebody else who looks just like me. And so one of the things that I've done as a practitioner is, as I meet and interact with folks, I learn a little bit about the culture. And therefore, when I was practicing, when I interacted with my patients, I knew a little bit more about the culture, and I could speak to some of those things. What that does is help that patient really connect with you. It brings those guards down. So you have to understand there's a great uneasiness or about patients coming in to see any type of physician, I'm sure, or practitioner. I'm sure you can relate to that. And one of the things that will help us to get more information, because if they feel uneasy about it, you're not going to get all of the information to be able to help, is to really be able to connect with them. And if you can connect with them on a cultural level, that is something that's going to be really key before you can even begin to do the work that you need to do.
How important is the support of family members in the mental health of a Black individual, a minority individual?
Family members can either help or hurt the person who's mentally impaired. So, for example, let's take someone with dementia or Alzheimer's. They go through different stages. That person is dealing with, just being afraid of not remembering, or, the long-term memory might be there, but the short-term memory is gone, it's fading, right? And so that family member who responds to this person who was dealing with these difficulties, if you respond in a negative way, you're going to get more negative results from that person. What you'll see is that person become very argumentative, very upset, and so on. Same thing with any other diagnosis. If you're dealing with someone who has depression or someone who is stressed out, just the way that we respond to them, just the way that we communicate with them can determine whether you have a good outcome or a negative outcome. So one of the things that we really need to pay attention to is how we communicate, how we interact with those that we knowingly are aware of that there is a mental health condition that they're dealing with. Now, sometimes we're not aware. So this is where the challenge becomes when you are a family member or a friend and you're not aware, but you notice that there's something off about the family member. I would ask that you extend grace and until you really get an understanding of what's going on, because that person may not even be aware of what's going on with them as well. But extend grace. I think that's the best thing that you can possibly do. And then encourage the person that you see that there's something a little bit off. Encourage that person to, let's seek some help. Let's see if there's someone that we can talk to, because I noticed that there's something different. I'm not sure what it is, but you encourage them to seek some sort of connection. And you want them to connect with someone that understands them from a cultural perspective as well, who has that cultural sensitivity and know, that culture is definitely a major part of what's going on. And you'll see that you can get a lot further with that than just going to any practitioner. You have the right as a client, as a patient, to request for a certain type of services. If you prefer a Black practitioner, you have the right to do that. And just know that you can advocate for yourself, whether it be a medical doctor or whether it be a therapist or anything like that. You have the right to do that. I want everyone that hears this to know that.
Thank you, Mr. Roberts, for that. We do need to take a quick commercial break. You are watching Black Health, brought to you by the Health Foundation of South Florida. Stay tuned. We'll be right back.
The sound of your heart can tell us so much. At Baptist Health Heart and Vascular Care, we listen closely to diagnose and treat simple to complex cardiac and vascular conditions. Our team of multidisciplinary physicians utilizes the latest treatments and minimally invasive techniques so that you can get back to what you heart most. Welcome to Innovative Heart and Vascular Care.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
The August 20th primary election. It's your voice and your vote, so make it count. Request your vote by mail ballot before August 8th. Easily track and confirm your vote online. Take Take action at miamidade.gov/elections or call 311.
Hey Miami-Dade, the August 20th primary election is approaching. Register to vote or change your political party online or by mail no later than July 22nd. Visit miamidade.gov/elections or call 311.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
Miami-Dade, we have an important choice this year, who we elect as our sheriff.
It's been 60 years since we elected this position, and the choice is clear for me. I'm with Chief James Reyes.
I'm with Chief Reyes too, because he understands our community and is the most experienced to keep our neighborhoods safe.
Chief Reyes has a plan to take on public corruption with a dedicated unit to deliver accountability for our community.
This August, join us in voting for Chief James Reyes.
I'm your mayor, Daniela Levine Cava. 3 years ago, I made a promise to build a government that listens, responds, and innovates for the future. And we've done just that. Now my opponents are falsely attacking my record, trying to divide our community. We've cut property tax rates, we've empowered small businesses to thrive. While they attack me, I'm committed to attacking our problems with clear solutions. It's what I promised to do 3 years ago, and it's my promise to you once again. Let's continue to get the job done together.
Welcome back. You are watching Black Health, brought to you by the Health Foundation of South Florida, and we are talking about minority mental health with Mr. Ruban Roberts. So, Mr. Roberts, you work with the youth. You work with teens. What are some of the unique mental health challenges faced by youth, and are there ways that schools can better support our youth since they spend a good majority of their time in school?
So one of the major things I think that teens deal with right now is just identity and personality. And a lot of that deals with social media. On social media, you can be whoever you want to be, right? And so if a person is insecure about how they look or how they, physically they're built or that sort of thing, they can mask themselves. That's one of the major things that we deal with mental health issues is that folks like to mask. So what the school system can do is really talk about how they can incorporate lessons on how to use social media more responsibly, and also educate parents about their ability to block some of the access that their children have to information that they are receiving. Remember, in social media, if you take, for example, the reels, I asked a kid the other day, I said, in the space of 1 minute, how many reels can you watch? And if you would guess this, you wouldn't even be able to guess this. But this kid said, I can see at least 60 reels in 1 minute. Think about it.
Oh my
the
goodness.
reels are only the reels are only like 3 seconds long, right? But think about it. If I have that much content coming into me and I'm watching reels for about 30 minutes, I'm not able to process all of that information, right? So I'm being programmed with all of this information that I'm seeing on those reels. All of that information is being stored in my brain, but I'm not able to process it to see, hey, is this something that is legitimate or is not legitimate? And if there ever is a time that I have to recall on it, I'm going to recall it on what's already stored in my mind. And that's a lot of time misinformation or false information. So one of the biggest factors that we have right now is social media. The second is music. Again, it's another programming effect. So when you see the kids who are into certain types of rap music, if it's drill music or trap music, drill music is music that creates violence. Trap music glorifies drugs and misogynism and that sort of thing. And so if you're listening to that 6 hours out of your day, again, you're being programmed. And so that's one of the things that we need to make sure that our youth are aware of so they can make, really conscientious decisions about what type of media that they're consuming and understanding what is meant for entertainment and what is real. And I think that that's one of the challenges that we have to face with. And that's something that we do in our programs that we work with youth and teen talks, is really to help them understand and decipher the difference between what's real and what's not, and how to use social media a lot more responsibly.
I think that's a whole nother show, social media. Not just for the youth, I think for adults as well. But
for the adults too.
I think more particularly affects. I think there's a greater negative effect on the youth because they're still in the developmental stage and finding
developing lives, right?
So we are at the end of our show. Unfortunately, I feel like there's so much more to talk about. We may need to have you back again, Mr. Roberts, to continue this conversation. But thank you so much for joining us today. Thank you for all that you do at Amplify Community Resources. And just briefly tell the audience where they could find you if they're interested in some of your services.
Sure. So you can find me at amplifycommunityresources.org. You just go to the website. You can see all of the work that we're doing. It's a wonderful thing that we're doing. Or just Google Amplify Community Resources or RER Consulting Enterprise or Teen Talks Florida. And you'll see all of the work that we're doing. We'd love to have you reach out to us. If you're a community-based organization that would like to utilize our services, we'd love to partner with you. If you're a municipality, local municipality that we have not partnered with yet, we'd love to partner with you. Thank you so much for this opportunity.
Absolutely. And real quick, where are you based in Florida, in Miami? What part?
So we work in Dade Broward area. We cover the two counties.
Awesome. Perfect. Thank you so much again, Mr. Roberts, for joining us. Thank you to all of you who are watching and supporting Black Health. Again, Black Health is brought to you by the Health Foundation of South Florida. I am your host, Dr. Michelle Kirwan-Bythewood, and you can find me on IG at Black Health Show. Until next time, everybody, have a great day.